Hello guys, welcome to Nurse's Diary. Today we will discuss about how to interpret ABG analysis. The name is arterial blood gas analysis. Okay. Today we will understand the trick to interpret the ABG analysis. The name itself says we are draw blood from the artery. If we draw blood from the venous, it is called venous blood gas analysis. Okay, before I start the main topic, before we go to the trick, we discuss few common points about ABG analysis. That is, the most common or preferred artery is the radial artery, and the peripheral circulation test has been conducted before the ABG analysis, that is Allen's test. Okay, now we are here to find out to sort out the simplest form of questions that we encounter in the examination center. Okay, in the question paper, the four values we have to remember before understand that the trick. Okay, for understand the trick to encounter this kind of a simple questions of ABG analysis or acid base imbalance. Okay, the first of all, the pH of a blood is the normal pH of a blood is 7.35 to 7.45. The normal PaCO2 value, the partial arterial carbon dioxide value is 35 to 45 mmHg. The normal PaO2, the partial arterial oxygen value is 80 to 100 mm of Hg, and the normal bicarbonate SCO3 negative value is 22 to 27 milliequivalent per liter. In few books you can see that is 26 milliequivalent per liter, but both the values are right. Okay, so there is no discrimination between these two values. Okay, these both values are right. Okay, you can see 27 or 26, both are right. Okay, now we come to the point that how to sort out the question. Okay, that's an important point, that how to sort out the question. Okay, we have to took three important values. We can forget about PaO2. Okay, there is no big role of PaO2 in sort out the question. Okay, in body it's an important point, but in this to sort out the question, that is not important. Okay, first value is pH. We should know the normal pH value is 7.35 to 7.45. The normal PaCO2 value is 35 to 45 mmHg, and normal bicarbonate SCO3 negative value is 22 to 27 milliequivalent per liter. Okay, then we will start the trick. When you see the question, first of all you will see the pH, and pH tells it is acidosis or it is alkalosis. If the pH is less than 7.35, it means it is acidosis, or it is more than 7.45, it means it is alkalosis. Okay, it is the simplest way to find out your question is going about acidosis or alkalosis. Okay, if it is going less than 7.35, we know if it's close to the 7, it is acidic behavior of a buffer, then we call it acidosis, or more than 7.45, it is alkaline behavior of a buffer, then we will call it alkalo. Okay, the second trick, the second point to find out it is metabolic or respiratory. Okay, if pH and PaCO2 are in a same direction, it means if pH increase, PaCO2 increase, if pH decrease, PaCO2 decrease, are in the same direction. Okay, are in a same direction, it means it is metabolic disorder. Okay, this metabolic imbalance. For the respiratory, if pH and PaCO2 are in opposite direction or reverse direction, it means if pH is increase, PaCO2 decrease, if pH is decrease, PaCO2 increase. So the reverse direction we will tell about the respiratory imbalance. Okay, so now we will see two examples to understand this trick. Okay, to sort out the question. The first example is where pH is 7.52. in the share page, where pH is 7.52, PaCO2 is 35, and SCO3 negative is 20. Now find out this acidosis or alkalosis. Okay, so here you can see it is a 25. Okay, I've taken this example from a book. There's 25. So you can see it is a low side of pH, it is in the lower side of PaCO2. The normal value is 7.35. It is a less than 7.35, so it is acidosis. Okay, now it is metabolic or respiratory. You can see it is less than 7.35. It is a lower side of pH. It is 35. Although it is a normal value, but it is a lower side of value, 35 to 45. It is a lower side of, although it is a normal value of PaCO2, it is a lower side. So we can say it metabolic acidosis. Now the second question is where pH is 24. Okay, it is the lower side of bicarbonate. Also we have to see that. Okay, but it will come in the compensation form. Okay, when we will discuss about the compensation questions, we will understand what is the role of this bicarbonate and PaCO2 values. Okay, these three values are important for the acid base imbalance questions. Now in the simplest form, it is acidosis or alkalosis. You can see definitely it's a more than 7.45, so it is alkalosis. Now is it respiratory or metabolic? You can see it is a higher side of pH and it is a less than 35. Okay, it is a lower side of PaCO2. So we know the trick. If pH and PaCO2 in opposite reverse direction, it will call respiratory alkalosis. Okay, if here is a pH is 7.52 or PaCO2 is 45, both are in the same direction or higher side, so it will be metabolic alkalosis. And here if pH is 7.25 and it is 50 and PaCO2 is 52, both are in opposite direction, so it will be respiratory acidosis. Okay, so guys, this is simplest way to understand the question. Sort out the question in the seconds in the exam center. Okay, so that's all for today. Thank you.